Hello everyone, my name is Jimin Lee and I'm a second year student majoring in international studies here at JBNU. Today I would like to introduce a business I hope to create in the future. It is called Health Bridge, a social impact startup designed to improve healthcare accessibility for underserved communities in Central Asia. Before introducing my business idea, I would like to briefly share who I am, what experiences shaped this goal, and why this idea is meaningful for my future career. I have a strong interest in global health equity, development cooperation, and social entrepreneurship. I am especially interested in how international knowledge can be applied to solve real-life social problems in local communities. My academic and personal strength is cross-cultural communication, and I speak advanced English, fluent Korean, and intermediate German, and I enjoy working with people from different backgrounds. Oh, here's a brief look at my CV and LinkedIn profile. And there are 4 key experiences that strongly influenced my career goal. First, I worked as a team leader in the Bridging Local Camp last year. During this project, I conducted field research in Uzbekistan for a healthcare development app project. I worked with Uzbek team members and explored local healthcare needs and development challenges. Second, since last year, I have been working as a youth education mentor, teaching children and middle school students. This experience taught me responsibility, empathy, and how to communicate complex ideas in an accessible way. Third, I joined the 2026 International Capacity Building Volunteering Program. Through this program, including planned volunteering in Kyrgyzstan this summer, I have been developing global teamwork and cultural understanding in real international settings. Finally, I am participating in the preliminary Startup Club Entrepreneurship Capacity Building Camp. My team's medical product drone delivery project received 8 million won in startup support this year, which inspired me to explore how business ideas can be used to solve real-world problems. Together, these experiences shaped both my values and my business idea. The business idea I chose comes from a real problem I observed. In parts of Central Asia, many people still face healthcare accessibility challenges. These include limited access to reliable medical information, difficulty finding nearby hospitals or clinics, unequal quality of care between urban and rural areas, and barriers related to language, distance, or digital access. While doing field-related research, I became more aware that healthcare inequality is not only a medical issue. It is also connected to information gaps, infrastructure, education, and development capacity. This made me think that even a simple digital platform could play an important role in connecting people to healthcare resources more efficiently. That question became the starting point of my business idea. So what's HealthBridge? HealthBridge is a digital healthcare platform for medically underserved communities in Central Asia. Its purpose is to reduce healthcare access gaps by providing practical, user-friendly, and localized support. The name Health Bridge represents the idea of building a bridge between people and the healthcare services they need. It also reflects my own goal of connecting international studies, field experience, and social entrepreneurship. Rather than trying to solve every problem at once, Health Bridge would begin with accessible digital services and then gradually expand based on local needs and partnerships. Healthcare would provide 5 core services. First, it would offer basic healthcare information in an easy and understandable format. This can help users access reliable information without confusion. Second, it would provide hospital and clinic location guidance so users can find nearby medical facilities more easily. Third, it would include health education content such as preventive care, maternal health, hygiene, and basic disease awareness. This is important because prevention and education are often as important as treatment. Fourth, the platform would include AI-based basic medical consultation support. This would not replace doctors, but it could help users identify basic symptoms, receive initial guidance, and know when to seek professional care. Finally, in the future, HealthBridge could be linked to drone delivery services for medical products or essential healthcare supplies. This idea connects directly with my ongoing startup project. To move toward this goal, I know I need more and a lot of preparation. First, I plan to learn Russian because it is widely spoken in Central Asia. This will help me communicate more effectively and build stronger connections with local communities. Second, I want to deepen my knowledge of development cooperation and global health because building a meaningful social impact business requires both passion and expertise. Third, I plan to gain more field experience through volunteering and international exchange programs. Fourth, I need to develop more practical skills in digital tools, project management, user-centered design, and partnership buildings. Finally, I hope to pursue internships in COICA, international organization, or NGOs, social enterprises, or health tech startups, and these experiences will help me learn how social innovation works in real institutions and build connections. In conclusion, HealthBridge represents more than a startup idea to me. It represents the kind of professional I want to become, someone who understands global issues, works across cultures, and creates practical solutions for communities in need. My next step is not to launch everything immediately, but to continue building the skills, networks, and field-based understanding necessary to make this vision possible. Thank you for listening, and I would be happy to answer your questions. So, as I mentioned, I am a team member of this team for startup project at JBNU Startup Center, and we received 8 million won to develop this business called AI Drone Service, which is we are going to deliver medical products, especially blood, to the rural areas in Korea that not like normal normal cars cannot deliver as soon as possible. So we are working on that project at the moment. Yes.
So what inspired your interest in international development and global health?
First of all, I used to live abroad, and there I worked with a lot of people from different backgrounds and cultures, which made me very interested in working with people from different backgrounds. And I think international development and cooperation, I get to meet so many people and I get to learn from them. So that it was my initial interest, I guess. Yes.
You mentioned that you want to do internship in COICA or NGO.
Yes.
Which field do you want to look for?
Right now, I'm also working as an education mentor, and healthcare is like something that I'm really interested about, but I wouldn't mind working in education field as well and just build connections so I gain more trust and partnerships with people. Yeah. Yes.
Can you talk a little about why especially healthcare? Like why you interested in it? Maybe you are from the family of musical, yes, or something like that. How
So,
it's related to you?
Yes, I joined this the Bridging local camp where we had to come up with an idea to solve this one development issue in developing countries in Uzbekistan. And while we were doing research, one of our Uzbek team members, his family was full of doctors, and we had a lot of insights from them. That's why we approached this medical idea. Yes.
How many members?
For this ongoing project. There's 6 people, including me. We have two people who have drone licenses, and we have people working in medical fields, and 2 of them are currently studying masters at JBNU, mostly engineering students. Okay, thank you.
All right.